Good afternoon, everyone. I am Andrea Bellafiore, the Director of Member Programs and Services at Leading Age Connecticut, and I want to thank you for joining us today for the webinar on rebuilding a strong census post-COVID. Today's webinar is going to be recorded, and later on I will share a link to the recording with you, as well as the slides when I receive them from Cheryl. Please type your questions into either the chat box or the Q&A box. And at the end of the webinar, we will go through and we'll respond to the questions. And now I'd like to welcome Cheryl Fields, the Group Product Leader from PointClickCare. Cheryl has been working and consulting in the acute and skilled healthcare settings for nearly 30 years. She has a passion for quality improvement, innovation, and technology in the post-acute setting among startup organizations. Cheryl has spoken at both the state and national level on a variety of topics related to post-acute care regulations, reimbursement, and quality measures, just to name a few. Let's welcome Cheryl Fields.
Thanks so much, Andrea. It's a pleasure to be with all of you today, virtually as it is. And we're really going to talk about strategies for rebuilding a strong census. I'll call it post-COVID, but really there's going to be an endemic, which we're all living with. And so some of these are strategies that we need to start thinking about today as case counts begin to possibly crest and level. As Andrea said, my name is Cheryl Fields. I am a nurse. I've been in this space for about 30 years, which starts to tell you a little bit about my age. Always in post-acute care, clinical informatics. It's really been an area of passion for me in my professional career. And as we talk today, right, January 19th, 2022, we still are dealing with an Omicron variant. Case counts are rising in different communities. And although with this variant, we're seeing some reduced mortality and morbidity, we do know that the population of residents that we serve, it still poses a significant threat for those that we love and care for and who are immunocompromised. So I certainly don't want to, as we talk through strategies for rebuilding census, I want to take that with a grain of salt. I know where we are in the pandemic today, and I know that we'll have some business conversations, but there's such an overarching empathy coming through with my message here today to all of you who continue to work and serve in this space. You know, from all of us at PointClickCare, we're incredibly honored to even have this time and conversation with you, and hope that there's some content, some ideas, some thoughts that we share today that can help with your organization as you position yourself in the marketplace. So again, today we're going to talk through strategies for thinking about your census. You know, in that role as a nurse, and any of you who are clinical in your families, you know that you get those phone calls, right, from families and friends who over the course of your career have considered a transition from wherever they call home to a senior community. And that could be SNF, independent living, AL, right? You always get the calls of where should I go? What do you know about this marketplace? That move from a town-based address to a senior living community, you know, making that move, it comes with pros and cons like any other major life decision. And today I want to talk about how your organization might help at this time of this great decision with some of the soft and hard types of metrics. Now, for each of you, this might look a little different, right? I know some providers, when COVID happened, they opened up COVID units and they remained very full during a time when others saw historically low numbers in occupancy. But everyone on this call really needs to think about and take stock of where you are in your local market. You know, we know SNF is going to be an important part of the continuum of care. We want you to stay competitive in this year and future years. And so knowing what that market, where you stand in the market share and how you can show your differentiation and your value is something that we're going to talk about today. And also we want to think about really listening to fears and objections of our customers, being very intentional about that, with the goal to, you know, build trust, bring some transparency, really act and serve out in the open. I think sometimes our sales teams are, you know, they're really feeling the pressure, right? You're really feeling the pressure to fill beds. And whether that's skilled nursing or, senior housing, sometimes under that pressure, we kind of get distracted by our metrics and we forget some of the basics of the human condition and our human relationships. And I'm going to try to keep a balance of that in this webinar so that you can think about how you use data and metrics to drive a conversation of trust, which really is going to help people move forward. Again, keep in mind, your census, it's going to be rebuilt one person and one family at a time. So with that, again, I just wanted to acknowledge, of course, there's a tremendous pull and a relationship between the current pandemic, occupancy, and frankly, staffing challenges. So this content wouldn't be complete unless I acknowledge that in many cases, you may be not allowing yourself as a team to accept a new admission because of your staffing challenges. Skilled Nursing News, actually did an article back in the fall. Delta variant was emerging and the requirements for vaccination were being socialized. Skilled nursing facilities all across the country were reporting that decisions to accept admissions were being based on staffing as much as they were being based on bed availability. Now, I will tell you that when I made decisions about admissions, 20 years ago in the clinical setting, in my subacute unit, I might have had 10 IVs running, and I knew how many RNs I needed to keep those lines going. And sometimes I would have to deny admission of another type of high acute patient because of staffing. What we're dealing with today is really dramatically different, and you all know that better than anyone. So again, I just wanted to acknowledge the impact that staffing can have on occupancy. Also, I read a report that Nick just posted this week, January 13th. They did a survey among their executive members that submit data to Nick. 9 out of 10 organizations said they're using temp or agency. And again, I know we're going to discuss strategies for improving occupancy, but understand that I don't want you to take any of these strategies and employ them and overshadow the importance of having adequate staff for safe provision of care. And we all know the story of COVID, right? How it hit SNFs and it had its impact on occupancy. So the state of Connecticut actually did a study and looked back on how your state had been impacted over the past 3 years, looking at occupancy. And of course, your average nursing facility saw a drop of about 14%. That varied across the different counties within Connecticut. But all of the counties saw a decrease in 2020. I'm sure each of you felt the impact of that. And as they go to look at 2021, there'll be some variation in that. Again, we see that the story of occupancy outside of Connecticut is really much the same, that our headlines, going back into 2020, all talked about the challenges skilled nursing facilities were having around occupancy. So again, June 2020, 6 months into the pandemic, we saw these kinds of headlines that was really putting a blow and plummeting occupancy. And at the time, rates were like 80%. Like as we ended the year, came to January, occupancy was around 80%. Well, right now we'd love occupancy to go back to 80%. I think I've seen the low from the 2021 period of year around 71%. And, there was a nice steady 7-month climb in occupancy from around January, February, this time last year, right up until July, August, when the Delta variant started to have another impact on occupancy. So again, our challenge, goes really deep into what we see nationally. And we also have to think about the impact, the long-term impact that some of those deaths in our sector will make on the demand. Beth Mace, who's the chief economist at NIC, she actually wrote about this in an article that she did back in May of 2021. And she actually talked about in senior housing that there would actually be 41,000 less units needed because of the deaths that had happened amongst the 85 plus cohort. So we have to think about not just the impact of today's community-based transmissions, but also the long-term impact of seniors who had passed away maybe earlier than they would have been expected to, and they would have in their future sought skilled nursing and or senior care. So this nationwide impact on occupancy and the numbers from the pandemic is going to be felt in our sector, probably for the next couple of years to come. Now, when we took a look, I mentioned, when we take a look at the skilled nursing occupancy, where we had trended through the early 2000s and then what's just happened in 2021, you can see that 7-month increase in 2021, where things were going from that low of around 70, getting back up to 74.5% occupancy. So we're not quite back to where we were this time last year as we rounded, and we've seen, again, sort of that net loss of about 5.5% nationwide. So let's bring a humanness, if you don't mind, into this discussion around, decline in occupancy. Everything on the slide should feel very known to you, right? But let's really think about what I believe has happened in our sector, and that really has to do with confidence and trust. So yes, we know that, outbreaks will result in some self-imposed admission bans. Your staffing may not be allowing you to take admissions. In your community, hospitals may have to turn on or off their elective surgeries. And all of this we've gotten used to living with now for, gosh, sadly, 1.5 years, almost 2 years of this real impact of the pandemic. But I think families really lost trust in residential housing, and they delayed placement decisions, kind of, opting to care for a loved one at home. Months later, right, we saw them fatiguing, feeling exhausted. And the first sign of hope was the vaccine, and now boosters, and your staff being vaccinated and your staff being boosted. So I think we really have to talk about how we discuss and communicate with these customers who've kind of lost some trust in our space. They're not thinking it's a safe place to recuperate or to rehab. And every one of my family and friends who calls me and says, so-and-so's had this change in health condition and they have to seek placement, they're all really concerned. And I'll talk about what those couple of concerns are. And I think there's an opportunity for providers to face and address and communicate right to the heart of those concerns when you're welcoming referrals and attracting folks in. All right, so first, certainly the vaccine and those boosters brought hope to our nation, right? The industry and our families. Again, as I said, I had friends who had put off elective surgeries, friends and parents of friends. And I'll tell you what, as soon as they saw the vaccine, they were hopeful and they had their vaccine, or they quickly moved into an assisted living where vaccines were available, right? They saw this as a great sign of hope. And suddenly, we heard from assisted living organizations, their phones were ringing again. And we saw that in the numbers. We just looked back in January, February of 2021, occupancy numbers started to steadily rise again. So if we look at the vaccine, now we have this vaccine mandate. We have, of course, there's some exceptions, right? We have family members who on many levels expect your staff to be 100% vaccinated, even those family members who themselves would choose not to take a vaccine. Again, it's an interesting dynamic, and I've seen from both sides. However, being able to tell that story, right? What has been your organization's approach to vaccination? What percent of your staff are vaccinated? What kind of screening or testing or outbreak data do you have? Are you having an outbreak? Have you not had one in 6 weeks? All that data that helps to be communicated to residents and staff on how are you managing in this COVID pandemic, and how are you keeping their loved ones safe? And at the same time, and we'll talk about it in a minute, how are you allowing them to visit with their loved one? Again, there's a lot of areas of concern around routine screening or testing. Will I, who have chosen not to vaccinate, be able to visit in your facility? If not, what are my options? If I have chosen to vaccinate and I'm coming to your facility to visit, what are my options? How often do you test? How often do you screen? How do I know that I'm going to be safe and my loved one is going to be safe? I've heard so many questions around this. And this is an area where you cannot over communicate. You think you've talked about it for months because you have, but keep in mind your referral has just started listening today. They haven't had to think about this potentially yet, right? That their loved one has had a change in health status, and for the first time, and they had been ignoring it, they're now dealing with the need for placement. So I've heard a lot of these kinds of concerns. And again, I think it's a place where we can meet our customers where they're at and bring some empathy and some data to help reassure them and to give some trust. I mentioned visiting and quarantine policies, and asking yourself, how have you made it possible for new admissions to have visitors stay safe, et cetera, et cetera. I've seen so many creative things that providers have done to bridge that gap, reduce family anxiety, right? Reduce some of the loneliness. I know that in some instances, families will choose to go home as opposed to deal with whatever restrictions your organization and the state that you're, functioning in and the condition at the time, right? We're talking about this in January, but gosh, I just don't know what next week is going to bring. So again, communicating what you've done, what kind of creativity you've brought. Are you one of those places that like heated an outdoor plastic igloo? Are you using all kinds of technology to bridge that gap, video conferencing, et cetera? So share those creative solutions with prospects, really validate their concerns and be forthcoming with that. They have this question on their mind. Also, I think it's really helpful to, share these great stories of your staff and their tenure and their dedication. What's it been like through the pandemic? That DON who's hung in there and worked, countless hours, and the staff that have maintained their loyalty to your organization, really tell that story. I would have it as poster boards within my units. I would have it up on my websites and social, so that both your staff and your customers know how much you value the humans who keep their loved ones safe. Again, I know some teams have, in the face of low occupancy, they have looked at some community outreach, and they may have been going with seniors or talking with seniors, going into their homes or going into communities where it was able to network to some of the future customers and have some of these, sort of future service conversation. Lots of transparency, again, building on your organization as being a trustworthy provider in your community. And I think that kind of helps people grab onto that sense of hope that they have, that they hope someone's going to be safe, and they can move to an action where they're going to take that step for admission. Let me share this story with you. This was actually McKnight's Gold Tech Award. It was just announced in December last month. This facility, ML Healthcare in Texas, they invested in this parlor. Now, if you take a look at the picture, I hope you guys can see that okay. There's a complete glass wall but in the middle of this parlor. And they allowed families to visit with their loved ones. They had great audio. They could see each other. They could hear each other really well. They facilitated a visit. They would have the same snack on both sides of the wall, so it felt like you were having coffee together. And then they would clean and disinfect in between visitors. Now, again, two important metrics to call out on the slide that we're all interested in, right? Satisfaction went way up, return to hospitals went down. So again, just an example of building a creative, safe space where residents and families were actually, able to visit, and the key results that the business is interested in were also achieved. All right, so kind of laying that foundation, let's get tactical here. Let me talk about our first strategy. Our first strategy for rebuilding occupancy is to take stock of where you are. And when I say that, I'm really talking about like your referrals. Hey, where are they going? It's a question that I have asked for many years. And you know what? It's easy for me to ask it. It's really challenging for you to answer it. It's sometimes you can do this if you have really good relationships in your network, right? And you can be asking those hospital discharge planners, hey, how many you got coming out this week? You know, any coming in our direction? Your home health partners, local social workers, they may know about seniors who are home or seniors who are at risk that might need services in the future. But again, it's not always easy to know exactly what is happening and where you stand in the food chain, if you will, of receiving data downstream. And as I suggested a few moments ago, remember those family members, those upstream referrals, they're really going to need some data from you to feel confident. We'll talk about that in a few slides. So for years, like I said, I've worked in this space. I've asked this question, hey, do you know where your referrals are going? And it was actually really hard to answer without making a bunch of phone calls, trying to aggregate a lot of subjective information that may not have been collected at the same time. And I know a lot of you are customers of PointClickCare. For all of you, we actually launched a solution in April of 2021 called Market Insights. And this actually uses public data, and we aggregate it all so that we can see the actual discharge patterns of hospitals amongst Med-Aid discharges in your market, and see where in fact they're going. So looking at the Connecticut market here in this example, I just pulled up the whole state of Connecticut. So in the whole state of Connecticut, you can see on the left, these are the discharges to the top 10 skilled nursing facilities, who's getting fed the most referrals and from which hospital. And so in your local market, and I know you could drill into New Haven or Bristol or Hartford and actually see what hospitals referrals are being dumped and who's actually getting them. So if the discharge planner is saying, oh yeah, no, we sent you all 10 that we had, actually, you can see that they didn't, that they sent those 10 to, for example, maybe they went to Lord Chamberlain Manor instead of going to your Masonic Care Health Center. So this tool allows administrators to actually answer that question. Now I'm going to bring up a couple of examples from the Insights application today, because to be honest with you guys, there's been so much turnover and upheaval that many of our PointClickCare customers don't even realize they have this tool in their pocket. So I'll say it a couple times today, check out Insights. If you're not sure if you have it, reach out and ask. But this is a tool that really helps you to know what share of the market your organization has won, and that's going to change over time. And believe it or not, it's changed a lot during the pandemic, as some organizations have closed, others have had, kind of dismal infection prevention control surveys, and their star ratings have changed. And you'll see that, referral patterns will follow in that star rating. So again, I think as we think about this combination of talking to people on a relationship level and providing the data that they might need to move the needle, the market insight reports can really help you to do that. There's also the ability to do a cost analysis, which can demonstrate the providers that actually have the lowest cost of care by DRG. So if you're going to have that conversation with your hospital partners and referral sources, it's great to be able to let them know that when they're sending their congestive heart patients into the market, you might be one of the least costly provider. That's a great conversation with payers as well as health plans. So again, this discharge patterns report is part of the Insights application. If you're not sure if you have it, log in and look. There's a big tab called Insights. And if you have any questions, I'll show you information at the end. All right, now that was a nice discharge pattern report, which gives us a lot of information around where the Medicare Part A referrals are going. But you guys know, number of managed care members really continue to rise across the country. Managed care enrollment nationwide, even this month, we see a bump up with the enrollment period, which has just closed. We now see 27 million enrollments by month in January. So we know that the managed care is continuing to grow. Knowing what's going on within your state and within these markets, again, becomes a helpful conversation piece when you're talking with health plans and convincing them that you are the valued partner in their care continuum. So again, having the opportunity to see what's going on either nationwide or again within your particular state and by the health plans that you have contracts with is a tool that we believe brings a lot of value in the conversation of how do I get these payers to ensure that I'm in the network and that we're getting the appropriate number of referrals. And there's a series of tools that will help you to tell that story, again, just a couple of finger clicks away. And that's the data that I think we really need to build trust. We want to demonstrate your capability and build on that conversation of trust, but also talk about the evidence to ensure hospital and payers that they should have confidence in you. Again, both of those entities are simply looking for you to demonstrate those capabilities with data. Now, some of that data they can get publicly, and you should know that, and you should be able to be prepared, to talk about those areas. But I also think there's some other information, data that you have that if you pull together will really help to strengthen that conversation. So I'm thinking about things like your own in-house acquired infection rates, right? In the midst of a pandemic, they're going to ask questions about, well, how well do you do, keeping infection from being transmitted through the whole population? And that really goes beyond COVID, right? We've been looking at infection prevention control in this space for years, well before the pandemic. So having those metrics available can help communicate with those hospital partners. So talk about your infection prevention control policies and procedures. Talk about your staffing and how you're handling staff, what policies staff are following, whether it's screening, testing, outbreak management, vaccination data, et cetera. What does your current staffing look like, right? They hear the news, they see the headlines, they know that staffing is a challenge. What's your current staffing? How much agency are you actually using today? And, what % of your staff, like I said, talk about tenure and talk about time with you. Again, at this point, they're assuming that, everyone's fully vaccinated, but there have been some staff with exceptions. So, and we sometimes will see that as an opportunity to have infection enter the building. So what % of your staff are fully vaccinated? Are you 100% fully vaccinated? That is a great piece of data to share. There's also new metrics that are going up on Care Compare. So CMS put out a memo just last week that talked about adding 2 new metrics to the 5-star. They're looking at weekend staffing and staff turnover, coming from your PBJ data. There are information that will be available publicly to your stakeholders. So again, be transparent, get ahead of that, go out there and speak about your current staffing. What does your weekend staffing look like? How is staff turnover managed within the building? So that you're able to build that confidence between you and your hospital partners that you are ready to receive referrals today, tomorrow, the next day. And again, that last piece of data that you might hold and they can't know about quite yet could be results from a recent state survey. Now, I know that we went through a period of time where it was all focused on infection, and now we've gone back to routine comprehensive state surveys. I know it's really daunting to the facility with all that you're also dealing with, but many of you have had great success in state survey and they're not yet posted. So you can share those recent surveys, especially if they speak better than your infection survey or the prior survey. So bringing that data and talking with your hospital stakeholders so they know today you're staffed, you've got great policies, you're ready to go. Recent survey has shown the same. And that, again, it helps to build trust in you as a great post-acute provider. We were talking just a couple minutes ago about sharing data and how your stakeholders, hospitals, health plans, family members are going to need data from you to feel more confident. As I mentioned, there are quality measures that can help give that confidence. Now, whether it's something as simple as the flu vaccine, like I pulled here from our quality measures report, but being able to demonstrate an outcome that may be of their interest. How long do people stay in your nursing home? How many times are folks ending up back at the at a hospital for an emergency department visit? Are you using telehealth to keep them well and in the skilled nursing facility and away from the hospital, which sometimes when the community outbreak is everyone's in the hospital with COVID, like the last place you want someone you love is hanging out in an ED, getting looked at, if you can avoid that with a telehealth visit. So I think those kind of data elements are of interest to family members. And they want their loved one to kind of breeze through your rehab for the shortest period of time possible, but reach those functional goals that are going to make it easier for them to actually transition home to that family who's loving and waiting on them. However, they don't want all that physical dependency if they can't handle it, right? So think about length of stay, discharge to community rates, average ADL improvement over those short periods of time. These are metrics that really are of interest with those family members. And frankly, I think these same metrics become of interest to your hospital partners and your upstream referral sources. So again, these can all be shared to help foster those relationships between the organization and its referral partners. Now, certainly, one thing that I really mention is to all along this process, as you're dealing with a referral, to be listening to fears, objections, try to really be empathetic. I know you're kind of used to COVID at this point, and to be honest, it's like, it's today, it is what it is, right? We're getting through it. But for someone who's maybe never been in the health system, this is their first experience in the healthcare system, they've been dreading this for 2 years, worried in fear that they might have to enter a healthcare system that they just don't know a whole lot about. They're going to come in with very raw, heightened, passionate fear. And again, I think it calls for both empathy and data to build that relationship and have that person feel confident to take admission into your building. I mentioned a bit ago, just a few minutes ago, about this past summer, right? And the survey teams were actually instructed to solely focus on infection prevention and control. Makes sense, we're in a pandemic. I was actually really curious to see how surveyors were tagging facilities. So this is a tool inside your Performance Insights application. So again, PointClickCare customers, if you have the insights, the analytics package, you have all of these tools at your fingertips. And you may not know because you've been way busier doing a whole lot of more other things, but it's just an opportunity for you to mention it because there's a whole lot of very efficient quality measurement metrics in that space, in that toolbox for you to check out. So as I was saying, I was really curious to see how were surveyors citing providers in Connecticut compared to the nation. So I looked back over the last year. Nationally, you see about 17.5% of citations that get documented at a scope and severity of a G level or greater. And most of, again, those are 17.25% related to infections, right? So F880, we see it all over the place. You really should be very proud of the way Connecticut skilled nursing facilities performed. In that same period of time, of the 679 citations in Connecticut, 78 were related, or 11%, 11.49 related to F880. And only 2 at G level and above, right? You had 31 citations at G level and above. Only 2 of those related to F880. That's really, really fantastic. That's really fantastic work in the state of Connecticut. And I hope you're sharing that. You know, I hope that you're able to share your success with your hospital partners and make sure others know how you're performing and how you're doing around showing compliance with these regulations when the surveyors do come in. Again, there were changes that were made to 5-star that came in a year ago this time in January 2021. They actually included, they folded in these focused surveys Prior to that, we had been told that they wouldn't. Now, again, CMS looked at the data and said, you know what, there's so much of it and it seems so normal that we'll just go ahead and fold it in. We'll talk about that in a minute, but it's interesting to see how that data plays out when you go to look at what surveyors were actually citing. So this survey tag analyzer actually has the data. We get it every month from all the states in the country around what surveyors are tagging, and we upload it into the analyzer. It's so cool. You can see what the citations are that's sort of being written down the street or across town. So if you're getting into your survey window, you know what the surveyors are, you know, what's the tag of the day, if you will, what they've been focused on, and what some of those significant findings are, which really helps your building prepare, especially if you've had any past non-compliance in some of those similar areas. So helping you to, really communicate that distinct value through the lens of survey tag and or 5-star. I mentioned that this time last year, CMS went out and did a recalculation of 5-star domains, and it's not news to us today. It happened a year ago. What was surprising, at that time was how many facilities were impacted by, some of those inclusions of past infection focused surveys. If we just look at 5-star as a measurement, again, remember what your hospital partners can find out about you is what they can go to Care Compare and see in your 5-star scores and how you're doing in quality scores related to short stay patients, right? That's their greatest interest. They're interested in sending you someone and that they're going to get cared for in their short stay period, and then you're going to send them home and not send them back. So I thought it would be really good to take a look at how your Connecticut was doing, again, compared to the nation. So the national averages are in the green, the top green text box, again, for 5-star for the most recent quarter. So looking at QM short stay, right, the overall 3.15 stars compared to Connecticut's 4.10 in short stay quality measurement. Those of you who have long stay patients, again, nationally, we saw that the star rating was about 3.14 compared to Connecticut's long stay quality measurement rating of 3.65. So in both categories, you're outperforming what's happening at the national level. And we opened up with staffing, right? And staffing at the national level overall was 3.17 and RN was 2.18, where Connecticut overall is 3.32 and RN staffing up at 3.48. So bravo to those of you in Connecticut who have done better in quality and better in staffing, despite slogging through a very long and arduous COVID environment. Of course, individual facility 5-star overall and component scores, you will see variations. This CMS 5-star tool, again, part of the Insights application, lets you see how you're doing and how your competitors are doing within that market. When you find that you have a solid overall and improvement in survey and improvement in staffing, share that message, share that distinct value. And there are going to be changes to 5-star. Again, we're going to have more surveys. We're going to have new metrics added into quality. There's new metrics added into staffing. But every opportunity that you have to highlight your strengths, which use your public data, encourage you to do that. What we've done inside Insights is to also take some of your electronic health record data, put that together to help foster a data-driven conversation that you can have that tells a more real-time story and doesn't wait for, it does two things. It has a broader source of data and doesn't wait for data that's coming in strictly from CMS public data sets. So again, when we think about your distinct value and having those meaningful conversations with network partners, and I think that really helps to think about, kind of getting through some of the clutter of data and get to the information that you need, that they need. That they're going to ask you about those things I mentioned: length of stay, emergency department visits, return to hospital rates, discharge to community. And these are just some of the key performing indicators that the Market Insights uses with these, intuitive visuals, some of these examples that you've seen, to help you very quickly pull that comprehensive story together for the industry, along with your real-time electronic health record, and then show that performance relative to others in the market. So it gives you the tools to highlight your strengths and have those data-centered conversations with hospitals. Now, mostly I've been talking about skilled nursing facilities, but I mentioned that, this idea of moving from permanently from your home to a senior living location, assisted living, independent living, and many of you have organizations that have extensive lines of business in both of these. So I thought it would be worthy to just talk about some of those strategies for senior living vertical as well. I'm also going to share with you a bit of a personal story. So the message from, the message on this slide is that you really can never underestimate the impact on occupancy that all of your staff have. And that's before, during, and after move-in. And that could be in a SNF and or in senior living strategy, in senior living. And I'll tell you why. And again, some of this is going to come from my own personal story. The woman pictured here, this is my Aunt Peggy. She actually lived with us for 17 years before she moved into an assisted living in New Hampshire. And so we're going out to go around and look at a couple of assisted livings. And again, she had had a fall and a fracture, and she was failing rehab and was really forced to stay in assisted living, not able to come home. So when I would go and ask her, what would you want to look at and what would you think of would be good of an assisted living, she would talk about and say, well, I hope that people are nice to me. And I hope, I kind of hope they have good food. So we're going off on a tour, and we went to a building that was not the most pretty, didn't have great lighting, would not have been my first choice. And we're on the tour, and she sees someone she recognizes. The current food service director used to drive her Meals on Wheels van like 5 years before. So suddenly this familiar face greets her, and they get chit-chatting. And the food service director is saying to her, oh, I remember the food that you used to shop for, and we can, we'll make you special meals and blah, blah, blah. So this is why she chose where she lived. It had very little to do with the staff that she met on tour, except for this one woman. Now, not only after she arrived, so we had to make a quick decision. So she goes to this assisted living. However, her favorite days, like when I would say to her, how was your day today? She was like, oh, it was okay. And then the next day she'd be like, oh, I had a great day because this food service director would have come down to her room, stopped in for a little extra visit. Maybe sometimes she would bring her a little extra something from the kitchen that was just for her. One of the things that she loved was that they wouldn't she didn't like her meat overcut. She didn't like those little cubes of meat that everyone seemed to get. And so maybe to all of you, this is not a big deal, but to her it was a huge deal to actually get an entire thigh of chicken. So they made the extra time to do something that felt like just for her. And I think that from that moment, that was how she decided where she wanted to go and to live, was this one familiar face. They felt like they had a bond. And so don't underestimate, how much of an impact all of your staff could have on occupancy. I've read a lot of articles and listened to a lot of podcasts this year around senior living, and there were a lot of variables which impacted occupancy. In 2020, they looked at that year as a close and said, hey, in order to fill our beds, we had to do more video tours. We had to find a way of getting to people. And there was one, the chief revenue officer of Enquire, Erin Hayes, gave a podcast in February last year that talked about they actually started doing porch visits. So they would go and sit on the front porch where the prospect lived and visit there. And that's where their admissions coordinators were having their conversations. And when they did that, they had 34% more move-ins than 8% without that visit. So again, just kind of thinking about meeting people where they're at, not forgetting that lots of activity amongst all of your staff really can affect whether someone decides to move in or not. Another idea that one of the podcasts suggested was, going to tour a building is a big event. And I would agree with you. Taking time from work, arranging the transportation, right? Getting in and out of my car, getting in and out of the building. It was a big event. And on the way out the door, they would send a little to-go meal. And that family said, wow, like I'm getting back. I don't have to cook. We're all hungry. We don't have to cook. And by the way, this sample of food was delicious. So if we were to choose there, which was very thoughtful, also we know that the food is good. So thinking about all of the ways that people are influenced in their decisions around making admissions. All right, so far we've gone on for about 45 minutes. We've been really focused on occupancy. I focus on data that you need to foster or maintain relationships, both with families, the community, and your upstream referral network. Now, I know that managing and adapting with the COVID-19, it really means that you're listening almost every day for changes, right? Federal government's been making changes, governing authorities, practice changes, the CDC. We have to pay attention every single day. Certainly, communicating that ability to keep up and your knowledge also helps give confidence. And from a competitive perspective, I think it becomes significant. Operators know, you guys know, you're not going to win every referral. Again, pre-COVID, we didn't win every referral. And we still had to ask those questions then, like, why are we losing a referral? Who are we losing it to? That same competitor may not still be in your space. There's a lot of moving parts today, and many operators, frankly, some are just no longer doing business, maybe under new ownership, new policies, new philosophies. And it just means that there's a prolonged period of time in front of you where you're going to continuously need to adapt to change and continuously be looking at your market. And I think that's another reason for any of you that are PointClickCare customers to just check out the Insights application to help you stay current and help you in that adaptation. As I mentioned a couple times today, and thank you for all that you do. Our PointClickCare customers, our non-PointClickCare customers, the fact that you came to work today and spent a little time listening to a recording webinar is just another example of your dedication and devotion to senior care. You are amazing. If you're using PointClickCare Analytics, the Insights application tool, you just may not be aware of the improvements that we made in 2021 and the reporting solutions. So I've put in a couple of slides, again, part of your handouts for you to go and to take a look at. Our team has worked to put key performing indicators available to you with our goal. Here's our goal: make you more efficient, give you less things to look up, just meet you where you're at and have you go be an expert manager, organizer, leader without having to go data chase. And our teams are constantly adding value to the application. In 2022, we're actually focused on some enhancements which will save more staff time. We're going to be delivering a predictive model to identify short stay residents who are likely to return to hospital in the next week and really drive those risk factors so your clinical team can mitigate on those risks. So I just wanted to share you a couple of slides so that go back and check it out. If you do have it and there's stuff to learn, we've got online help, we've got videos, we've got tons of people who will spend just a few minutes if you have questions on any of these reports. And really, to keep up the great work. We really want to encourage all of you to keep up the great work. A year ago this time, there was an article out in skilled nursing, McKnight's Senior Living, really talked about, they did a survey with residents and families in both the US and Canada. And you know what? You guys are doing an amazing job. People felt cared for. They felt like you were making the right decisions. They felt like while you were doing a good job with communicating, you can always do more with communication. So please keep up taking care of yourselves and keep up the good work of communicating with your patients and families. It is because of you and your dedication that we even have this sector of the industry, sort of standing on our feet as it was today. I know in wrapping up here, and I want to leave time for questions, it will take time to rebuild your census. We've talked about all the reasons why. I think those who focus on the human side and really build trust and listen to the fears and the objections of your customers as they come in will win out on others who are looking at it as more of a head in the bed business transaction. And remember, sharing data to help regain trust, maintain trust, build trust is a wonderful way to help bridge that gap. This facility report card, again, is part of the Market Insights report. What's unique about it is all of the key performing indicators that your stakeholders are interested in. So admissions, readmissions, ED visits, return to community. All those metrics take a long time if you're trying to do it manually. Because we have your electronic health record and what's going on in the marketplace, we can blend that together and in 2 clicks, actually give you a report for a specific hospital or a specific payer or a specific diagnosis group. So when you're trying to build that trust and share that data, we don't want you to have to spend any time to do that. If you're having a lot of turnover among staff, like I said, if you're a PointClickCare customer and you're not sure if you have the Insights application package, just contact us. We'll be happy to check that out for you and answer any questions that you do have about that. All right, so with that, I'm going to, again, thank you all so much for time and attention today, and we will open it up for questions.
Thank you so much, Cheryl. That was great. So I do not see any questions. We'll keep the webinar going for another minute or so in case someone's in the process of typing.
While we're waiting for that, I'll just, in this last slide, the Samantha Pitton, the account executive for the state of Connecticut, has very graciously given all of you her email address and her direct line. So if you do have any questions about your service package at PointClickCare, you can certainly contact her, or you can contact your own CSM if you know who that person is. So if you don't, and I'm also going to put Sam on the hook and say, if you think of a question after, send that off to Sam as well, or to Andrea, and they can get it to me and we can be sure to get it answered. I will make the slides available. I'll send them off to Andrea after the fact. And so you don't have to worry about that if there was anything that you wanted to look back and refer to.
Thank you. All right, I do not see any questions, so I'm going to conclude today's webinar. And I'd like to thank you again, Cheryl, for taking your time to present to Leading Age Connecticut.
Absolutely, my pleasure. And like I said, thanks to all of you for the amazing work that you do every day. I know your patients can't always say thank you, your family members can't always say thank you, but having been both a family member to many of your types of patients, I will thank you on behalf of all of us at PointClickCare. The work you do is amazing. Hang in there. Thanks so much for having us today.
Oh, we got one question. Oh, it says very informative. Thank you. Thank you, Mark. All right. Have a good day, everyone.